someone please get started, tell us about your entry into Health IT, and did you have mentors when you first came in?
I would tell you, Bernie, I stumbled into it. I had gone back, I was a practicing clinician, and went back to school to get my MBA because it felt like I needed to do that, interestingly, to hold my own in meetings. It was funny, our CFO at the time, I went and finished my MBA, and our CFO said, great, now we have the same degree. And I looked at him and said, no, you get your MD and we'll all have the same degrees. It was, well, but it was interesting because in that sense, it was a male, yes. And so, but it was interesting because it was through that educational experience that lit my passion around Health IT. I really become exposed. I mean, Judy laughed about the age. I mean, when I went through college, it was, little dots on paper that on big machines in the basement of some building that you were afraid to go into, right?
Yes.
That was the whole computer. And so to be able to see what was possible was just very exciting to me. And so from a mentor perspective, there certainly were no female mentors available to me at that time. There was one gentleman, our CIO at the time, that was very helpful and recognized my enthusiasm and helped to shepherd that.
So it's beginning to sound like it was mentorless for the most part.
Really,
if I can answer, I started in the early 80s as a programmer, and then I had an analyst position, and I actually worked for a VP of IT who was a female, and then once she figured out that I knew what I was doing to figure out the non-mainframe world at this large organization, she moved me under a director who had all the applications, and she too was a female. But I have to say I got little mentoring from them at that time. They were not there that long. I moved into management in '84, and I had a 5-year period where I was the only female on the IT management team at that large healthcare organization. And there was, definitely a little bit of the good old boys network. I was a young mom with young children, and given my experience, I think that has helped shape I know what it takes, and to try to give back to other women, because they really didn't have that at that time.